So the lab tech surveys Witchcast, Mastercast. Distobuccal cusp of mandibular molar occludes with central fossa. Correction of recession of canine, lateral repositioning flap or sliding flap. Patient on long-term tetracycline therapy returns complaining of burned tongue. Smear results are yeast and fungi. What's the treatment? Clotrimazole. Remember that clotrimazole clotrimazole is used to treat yeast infections like vaginal yeast infections, oral thrush, diaper rash, and some types of ringworm, including athlete's foot and jock itch. Okay. Um, Clotrimazole is a clotrimazole. Let's see. Systemic and superficial infections. It has a wide coverage. It's part of the family of the azoles. Okay. It blocks the formation of ergosterol. It's an antifungal. So ketoconazole, clotrimazole, miconazole, and the fluconazole, itraconazole, and voriconazole, they all block the formation of ergosterol. Ergosterol. Let's see how's that word pronounced. Ergosterol.
Ergosterol.
Ergosterol. So clotrimazole inhibits the formation of ergosterol. So for a patient who has been on a long term of tetracycline therapy, and thus the fungi and yeast, which are opportunistic infections, they are starting to develop. So to stop that yeast, you use fluconazole, either fluconazole or clotrimazole. So identify anemia based on lab values. Hemoglobin less than 12.5 is an anemia. What are the symptoms of hyperpituitarism? Symptoms of hyperpituitarism. Excess hormones. Remember, if you have hypersecretion of the pituitary gland, you have all the hormones that are related um, to this gland, which are going to be growth releasing hormone. So you'll have a patient with gigantism.
Excess hormones.
Gigantism, which is pronounced
Gigantism.
gigantism. So a patient with gigantism, okay, oxytocin, ADH, TSH, follicular stimulant, luteinizing, or no, not luteinizing, luteinizing, ACTH, corticotropin hormone, and prolactin. That is a patient that has hyperpituitarism. The pituitary gland is secreting a lot of hormones. So, symptoms of myocardial infarction: burning chest, numb arm, pain in the jaw, not pounding heart. Okay, symptoms of myocardial infarction: burning chest, numb arm, pain in the jaw, but not pounding heart. Treatment of Bell's palsy: histamine and vasodilators may shorten duration, as well as systemic corticosteroids and hyperbaric oxygen therapy, surgical decompression. Topical ocular antibiotics and artificial tears to prevent corneal ulceration, because the eye is not being closed completely. There can be some drying, so corneal ulceration can happen. Pregnant woman that is allergic to penicillin, what do you premedicate her with? Erythromycin. You have an HIV patient with purple red lesion on the ventral tongue, Kaposi sarcoma. Kaposi sarcoma. Treatment of dry socket: eugenol impregnated pellet. Do not do curetages. Treatment of oroantral fistula. Buccal slide flap, which is not an etchant or conditioner. Well, which is not an etchant or conditioner. And I have here a list: bisphosphonates, bis-GMA. Bis-GMA is a resin commonly used in dental treatment, dental sealants. It is the diester derivated from methacrylic acid and the bisphenol A diglycidyl ether. Bearing two polymerizable groups, it is prone to form a cross-linked polymer that is used in dental restoration. Bisc-GMA. Bisc-GMA. So the question: which is not an etchant or conditioner? Bis-GMA is not. Bis-GMA is a sealant. The etchants or conditioners are citric acid, maleic acid, or phosphoric acid. Bis-GMA is not. Bis-GMA is the sealant of faucets and fissures. Next, fusion versus germination. A fusion, it has two buds, and the germination is one root. Expired or aged film will appear too light. Histology of a fibroma: nodular mass of connective tissue covered by squamous epithelium. Nodular mass of connective tissue covered with squamous cells. Again, histology of a fibroma: nodular mass of connective tissue covered by squamous epithelium. Nodular mass of connective tissue covered with squamous epithelium. Fibromas can grow in all organs arising from mesenchyme tissue. The term, okay. full lower denture with overextended distal buccal phalange causing denture to dislodge. What is what muscle is impinged?
Full lower denture with overextended distobuccal flange causing denture to dislodge. What muscle is impinged? Masseter.
So full lower denture with overextended distal buccal flange causing denture to dislodge. What muscle is impinged? Remember that the masseter will be in the in the area of the distal buccal flange. It is very typical that you use a lower denture and the distal buccal flange is being dislodged because of an overextension and uh, that is being placed on top of the masseter. What is a Coumadin test? What does the Coumadin test? Prothrombin, and this is the extrinsic pathway. Next question. What is the treatment of a dentigerous cyst? Surgical removal of cyst and tooth. So, next question.
Cyanolith is visible on X-ray. Cyanolith is visible on X-ray. What duct is this?
Cyanolith is pronounced
Cyanolith.
na. Cyanolith, according to, well, I think it's cyanolith.
Cyalolith or cyalolith.
Cyalolith or
Cyalolith or cyalolith.
A cyalolith is visible on X-ray. What duct will be on in Wharton's? Wharton's cyalolithiasis, also termed salivary calculi or salivary stones, is a condition where a calcified mass or cyalolith forms within a salivary gland, usually the duct of the submandibular gland, also termed Wharton's duct. Wharton's duct, that is in the submandibular gland. That is the most usual. So a cyalolith is visible on the X-ray. What duct will be on? What lith is visible on the X-ray? What duct will be on? Wharton's duct, which is the submandibular gland's duct. Wharton's duct. You're having difficulty selecting a shade for porcelain fused to metal. You should decrease gray and decrease hue. You're having difficult selecting shade of porcelain fused to metal. You should decrease gray and decrease hue. You are having difficulty selecting shade for porcelain fused to metal. You should decrease gray and decrease hue. Next. What are usual complications after insertion? What are usual complications after insertion? Working or non-working interference. What are usual complications after insertion? And I'm assuming they're talking about a restoration. Working and non-working interference. If you notice occlusal interference after insertion, when should you make adjustments? You should make adjustments at insertion if you notice occlusal interference after insertion. Next, best teeth to oppose natural dentition, acrylic. Best teeth to oppose natural dentition, acrylic. We have a patient that had a slow growing jaw for 10 years, hyperpituitarism. Hyperpituitarism, it can be caused by gigantism. Second molar below plane of occlusion. What do you do? What is the problem? It's most likely due to ankylosis. Second molar below plane of occlusion. Outcome of direct pulp cap would be better in young or old teeth. Young teeth. Direct pulp cap would be better in young teeth because their apexes are bigger. After scaling and root planing, what is formed? After scaling and root planing, long junctional epithelium is formed. After scaling and root planing, long junctional epithelium is formed. What is the purpose of palatal expander? To correct crossbite. Purpose of palatal expander. What is the purpose of a palatal expander? It will help widen the jaw to fix a crossbite. So it will help you align the positioning of the teeth most times by creating space, which is what most times is needed for crossbite problems. What is the ideal amount of undercut for a circumferential clasp? 0.01. Point is the ideal undercut for Okay. So what is the effect of hydrochlorothiazide on hydrochlorothiazide? I think this is a diuretic. Hydrochlorothiazide is a medication used for high blood pressure and fluid retention. Yes, it is a diuretic. And I believe the physical mechanisms, I don't really know if it makes sense, but it can just be part of since there is less saliva with hydrochlorothiazide, maybe there's less retention. I'm guessing, I don't know. So anyway, the question is, what is an effect of hydrochlorothiazide on periodontium, completed denture, no effect on periodontium, or decreased retention of complete denture because of decreased salivation. I get this is the one that makes sense to me. Um, let's see, hydrochlorothiazide and salivation. Um, yeah. Well, in some sources, I'm seeing that there's actually some places where it says that there's actually an increased salivation in patients using hydrochlorothiazide. Um, I don't know. Um, it says in a study done in 2003 that um, prevalence of drug-related dry mouth and risk groups. So saliva consists of two components secreted by different independent mechanisms. First component includes ions, mainly by the parasympathetic stimulation, and secondly a protein component released by sympathetic stimulation. Salivary gland secretion is mainly under autonomic nervous control, although various hormones may also modulate salivary composition. Secretion appears to be dependent on several modulatory influences which act via either a cyclic AMP or a calcium-dependent pathway. Parasympathetic stimulation produces copious saliva of low protein concentration, while sympathetic stimulation produces little saliva but on high protein concentration, and thus may give a sensation of dryness. Dry mouth has a variety of possible causes. Common habits such as tobacco smoking, alcohol, including mouthwashes, and use of beverages containing caffeine can cause some oral dryness. A wide range of drugs can give rise to oral dryness. Hundreds and thousands of drugs, if not thousands of drugs, may be serogenic. Some causes cause subjective complaint of dry mouth. Anyway, drugs that are most commonly that drugs are the most common cause of reduced salivation. There's a table in number 2. Okay. And well, I need to know if hydrochlorothiazide is considered a I don't know what. It's a diuretic. So, oh yeah, it's an anticholinergic drug. It's a diuretic. So it might produce some dryness. So let's just go with that. I'm not gonna study these all day. So next, what is not acceptable? An acceptable surface disinfectant, alcohol based. substances. What is not an acceptable surface disinfectant? Alcohol base. Phenol, chlorine, and iodine are acceptable. Alcohol based are not acceptable surface disinfectants. Okay? What is not an acceptable surface disinfectant? Alcohol based. Composite to closed diastema, hybrid.
Composite to closed diastema.
So a hybrid resin or a hybrid composite. Hybrid composite. Hybrid dental composite. Those can be used to close the diastema. Resin retained. Okay, yeah. Diastema closure with a microhybrid composite resin. Composite resins. So, patient with tenderness anterior to the earlobe, in the intraoral examination reveals inflamed Stenson's duct. What do? Stimulate parotid gland, checking for exudate. Next, clinical picture of gutta percha introduced to sinus tract. It does not go to apex, therefore it's a perio abscess. Next, clinical picture of premolar with enamel hyperplasia. Enamel hyperplasia. Enamel hyperplasia. I think that we're talking about hypoplasia, not hyperplasia. But enamel hypoplasia is a defect of the teeth in which the enamel is deficient in amount caused by defective enamel matrix production.
Caused. Enamel hypoplasia is a defect of the teeth in which the enamel is deficient in amount, caused by defective enamel matrix formation.
Caused by defective enamel formation. Again, clinical picture of her premolar with enamel hypoplasia. What could these be caused by? Trauma or infection of primary tooth. Next, most stable impression material, PVS, polyvinyl siloxane. PVS is the most stable impression material. What is the most accurate impression material? Most stable, PVS. Most accurate, polyether.
Polyether than PVS.
Polyether.
Polyether is a class of organic substances prepared by polymerization of many simple compound molecule monomers and establishing ether links in between them. So those establishing ether links between them make those simple compound molecule monomers be stable. They appear in a chain-like network of molecules comprising an unusually diverse group of polymers. So that is why polyether is the most accurate impression, and then PVS. Now, PVS is the most stable impression. Polyvinyl siloxane. Polyvinyl siloxane is a addition reaction silicone elastomer. To evaluate and compare the linear dimension changes of the three, okay, so the most stable is the polyvinyl siloxane, and the most accurate polyether. And just as a reminder, the polyvinyl siloxane is the putty, polyvinyl siloxane. Okay, there's also the cartridges now, polyvinyl siloxane, and the polyether impression material. Remember the two pastes? Yeah, polyether. And polyether, remember, that is going to be more accurate, polyether, but the more stable will be polyvinyl siloxane. What is a disadvantage of irreversible hydrocolloid? Dehydration. Irreversible hydrocolloid, their disadvantage is dehydration. Disadvantage of irreversible hydrocolloid, dehydration. Alginate is the most commonly known irreversible hydrocolloids. A tooth to receive a porcelain fused to metal crown is sensitive to cold. What is the cement of choice? Glass ionomer and poly